Reports of systemic racism in the healthcare system and COVID-19 has made the issue even more urgent. Doctors are bringing this concern to light, saying black and brown patients are treated differently. Joining me now is Dr. Amanda Little-Richardson, an OB-GYN at Kaiser Permanente's San Jose Medical Center. Hi, doctor. Thanks so much for joining us. I know it's been very busy for you. How's it been treating pregnant women during a pandemic? We didn't think it was going on so long, but there's been a lot of babies born during COVID.
Yeah, there have been a lot of babies born. I mean, nothing has changed in the sense of there are still pregnant women that need care, and we've been able to continue to provide, excellent quality care. Luckily, I work within an organization that continues to have, has taken extra precautions for our safety as clinicians, but also the safety of our patients. I think that our pregnant women are just coming to the table with a little bit more anxiety, concerns, because the guidelines and recommendations continue to change. But, it's my job to stay up to date, and we're doing our best to bring up-to-date recommendations during this really trying time.
Yeah, hopefully that will put their minds at ease a little bit as they're pregnant right now. We want to talk about racism in healthcare. You report that black women are 4 times more likely to die from pregnancy-related complications than white people. Why is that?
I mean, it's a multifactorial issue. I mean, for one, California actually has been the only state to see a reduction in maternal mortality, and that's through the California Maternal Quality Care Collaborative, which in 2006, since its initiation, has been initiating maternal health care bundles. And so it's giving us a systemic approach to how we care for our patients regardless of race. But even though California has seen such a drastic improvement, that disparity by race still exists. And so unfortunately, we come to the recognition that in the United States, we have a problem with racism, and that racism is in every aspect of American life, and that extends as well to healthcare. So the true issue to improving those healthcare disparities, these poor maternal health outcomes for our Black and African American patients, is by recognizing the systemic racism, the bias that clinicians bring to the the care of these our minority patients, and improving that.
So is it just basically racism, or is it also like a socioeconomic problem too, based on different communities of lower income, and that's why they're treated differently?
Yeah, that's an excellent question. So even when we hold for things like education level, socioeconomic status, total income, we still see that disparity within African American patients and women dying at higher rates and having more complications. So it's not based on access to healthcare alone. It is a level of systemic racism. And that our people, we don't recognize our biases, and that when a patient of color complains about pain, we do interpret that pain score differently. And we find that our patients are getting less pain medication, for example, because of the stereotype that Black patients are pain seeking. And so I'm really happy to work at an organization like Kaiser, which has been very forward-thinking and committed to reducing these healthcare disparities. They recently pledged $60 million in social justice and racial outcome research and efforts. And those are the steps we need to improve healthcare for all of our patients.
I know we are out of time, but I want to quickly mention you wrote an article calling for more to be done to bring more Black and brown people into medicine. Do you think that will help the problem?
I think it will. I mean, the more diversity of thoughts, backgrounds, everyone views a problem differently, so they're going to bring unique solutions. And all of that is only going to improve the healthcare quality that we provide to our patients. The more the merrier, truly.
More diversity, the merrier, too. Dr. Amanda Little-Richardson from Kaiser, thanks so much for your time tonight.
Thank you.